Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Enovex Total Wellness Pharmacy is a state-of-the-art, fully compliant, integrated pharmacy specialising in compounding sterile and non-sterile preparations, as well as providing services such as nutrition, IgG and IgE, allergy, stool, hormone, cholesterol screenings, and consultations leading towards a path of optimum health. Contact them at 888-ENOVEX6 or info@enovexrx.com. My guest today is Dr. Ike from Enovex, the compounding laboratory, which is a new facility, but I'll let Dr. Ike tell you about that. Thank you for joining us today.
Thank you for having me.
Before we talk about your new facility, could you tell us who you are, what background you have to date?
Okay, sure. Well, my name is Ike, and I've been a pharmacist since 2003. I graduated from USC School of Pharmacy, got my bachelor's in biochemistry from UCLA. So depending on which game we're watching, I'm either a Bruin or a Trojan. So, and started out in a chain working as a pharmacy manager, and during the transition from Long's drugs, if people in West Coast might remember when CVS bought them out, and I didn't like how CVS was treating their customers, and however it was becoming a number, and everything was about just times and not really patient care. I decided to open my own pharmacy in 2010, and that same year, I was always kind of integrative in my mind and thinking about natural and alternative therapies. I started going to A4M conferences where I got a lot of education about new therapies and alternatives and hormones and such. I got introduced to LDN during those years, and started doing the fellowship with the A4M. I'm halfway through the fellowship program, but attending a lot of other conferences like Scripps, trainings from Metagenics and things like that. So basically, I educated myself in integrative functional medicine and had a compounding/retail pharmacy for a long time. With the new regulations in California, stricter, and the compounding labs have to adhere to very strict guidelines. We had to open a new facility. That's where Enovex comes from. We opened Enovex Pharmacy. It was 2 years in the making. It's absolutely wonderful, state-of-the-art facility with all kinds of equipment, high-end, and so it's been about almost a year in existence, and it's a compound-only pharmacy. We do compounding only, and we got away from the insurance model, so it's cash-only compounding pretty much. And that's where we are. Our best forte is our skills, training, and customer service. If you believe Yelp, some do, some don't. We had the highest reviewed pharmacy on Yelp in United States. Wow. It was Dr. Ike's pharmacy. Mm-hmm. So we transferred the patient and the business to Enovex Pharmacy. So nothing's new to us, but that's where we are right now. We have a sterile and non-sterile license. We're approved in about 6 different states to compound, and that's where we are right now.
Mm-hmm. So those states that you're licensed in, does that mean you can fill prescriptions from other doctors in different states?
Yes, we can either fill prescriptions from the doctors from those states, or we can ship out to those states if the patients come here and they get treated. They basically started out by a lot of patients coming in seeing physicians here who specialize we have a doctor that specializes in treating traumatic brain injury for soldiers, and he sees patients from all over U.S. So they come in to him, returning from their duties in Afghanistan or Iraq, and he treats them with his protocol with traumatic brain injury, and we make the medications for him. So, there was a need to be licensed in other states to be able to ship out the medications to those states.
Mm-hmm. And LDN also works with post-traumatic stress, which is very interesting.
Yeah. Yes, it sure does.
So before we talk about LDN, what other medications do you compound in your super duper new pharmacy?
Well, it's kind of the little bit of everything. We compound pain management creams. That's kind of been doing that for a long time. We compound hormones. We do our own testing, screening, I should say. As pharmacists, we can't test. We have to screenings of hormones. I do consultations with patients where they could come in. We looked at the results and see how we can balance their hormones into natural physiological levels, which is really important, natural physiological level, and not to overshoot the levels. Some doctors still do. They prescribe supraphysiologic dosing to patients, and they go too much progesterone or too much estrogen, too much testosterone. So we compound hormones, we compound naltrexone, we compound things for pain management. We do a lot of work with hospices, where we compound ultra low dose naltrexone. We can talk about that in a bit. Ketamines, morphines, things of that nature. And we're slowly getting into sterile compounding. Sterile is pretty new for us. We're not going to claim we're experts at sterile, but we're slowly getting into it, and we will be soon.
I'm not very knowledgeable. What is sterile compounding? To me, I might think that's like injections, is it? Or am I totally wrong?
Yes. Okay. Absolutely, injections. Something that's going to go into somebody's body by injection route, it has to be made in a sterile room with all kinds of regulations. We had one bad pharmacy that kind of messed things up for us. New England company, NECC, the disaster, people died. But after that, all the states and federally adopted new tougher regulations, and it's for patient safety, so it's all good. Some of the regulations are prohibiting doing normal compounding, but for the most part, the regulations are there to protect the patient so that patients can feel safe, knowing that their medications are going to be sterile, and they're not going to be any toxins or bacteria or funguses growing in there when they inject themselves.
Very important. So the non-sterile, I'm assuming you do capsules and tablets, sublingual liquid. Do you do any? I know one pharmacy, pardon me, made some like gummy bears for children. Do you do anything like that?
We do make gummy bears for other meds. I would talk about naltrexone, but we haven't made gummy bears for naltrexone. We can, it's possible, if need be. But suspensions work really well for children. We make creams for smaller ones. You can make a cream. We can make naltrexone. We sometimes use in a cream formula for healing of wounds, which is pretty amazing. So improves healing across the board. So if you have a wound, you put naltrexone in there and improves the healing time. And obviously the capsules. That's pretty much it.
educate me. I don't know about the healing LDN cream. I'd be very interested if you could talk me through that.
Well, there are formulas that have been tested to contain low-dose naltrexone in a cream with ingredients such as maybe phenytoin, misoprostol. Those are also. I don't want to get too technical. I don't know. Half of the audience might, but prostaglandin analogs. I mean, they improve healing. They've been shown to heal wounds faster than pretty much anything in the market. So we would make a cream, especially for our hospice patients, where they have like stage 2, stage 3, or sometimes even stage 4 wounds, and they would control and sometimes heal the wound. For hospice patients, it's really difficult to heal something because if they need the non-nutritious state that their body is in, very poor nutrition. A lot of them are not consuming enough proteins, but you can still control the wound, try to heal it a little bit. Sometimes we'll put metronidazole, which will control the anaerobic bacteria and the smell, and we would throw in some lidocaine to control the pain. So you kind of have all-in-one wound formula to heal and to control the smell and the pain and the discomfort. So, these patients could be comfortable.
Mm-hmm. What sort of wound are you talking about?
What sorts of what?
Wounds. Wounds that
I think
when you the cream that you put on the skin, what kind of wound is it that you would hope to heal?
Oh, like sacral ulcers, like pressure ulcers that would become wounds.
Oh, right.
Any type of wounds, diabetic wounds. Like bed sores that turn into a big, huge ulcer and with bones exposed. It's really bad. I mean, the pictures are pretty gruesome when we see them, but before and after, it's really interesting.
That's amazing.
Now, most of these patients are bedbound, when they're in hospice care or palliative care. So they develop these wounds if they're not properly taken care of, and that that formula helps tremendously.
Would it help with ulcers as well, on ulcerated legs?
Yes. Yeah.
Well, that is amazing. My father has passed away now, but he used to have terrible ulcers that wouldn't heal. So if there's anybody out there,
like venous.
Yes, if there's anybody out there listening and they have problems with ulcers, this is the treatment.
There are some ulcers that absolutely. There's some ulcers that are they need also increased circulation, blood flow, and if that's the case, we can throw in possibly nifedipine. There's a formula with nifedipine we can add to increase the blood flow, or pentoxifillin. Those are things that would increase the blood flow in the area. So there's, depending on the exact type of wound and stuff, it's not very difficult if talk to the clinician and find out what type of wound it is, and we can help to come up with the formula for it.
Well, that's amazing. And which states can you ship to now?
Right now, don't have all my license in front of me, but we have California, obviously, Nevada. We have Massachusetts, Louisiana, North Carolina, Pennsylvania, Wisconsin, and Oregon. I believe we have Oregon.
Okay. Where the conference is going to be.
Yeah.
Oregon seems to be the place for naturopathic doctors and doctors that think outside the box. I think there seem to be more of them there, so that's quite amazing. So that's really interesting. So the LDN, let's talk about that.
Okay.
So you do all of those different formulations that we discussed, and your capsules, do you make those to order, or do they come in a set dose form?
Oh no, we make it according to the order that's prescribed. Usually we'll on the low dose naltrexone, we want to kind of hit the 4.5 mark. Mm-hmm. So we'll start the patients on a 1.5 for a week and have them go up to 3 for a week, and then after that to 4.5. And that's just precautionary, but most people don't even experience any side effects.
Mm. When we did a survey, we found that only 5% of people had side effects. And you were going to tell us about ultra low dose naltrexone?
Yeah, ultra low dose naltrexone is actually pretty amazing. I'll have some success stories I can tell you. So ultra low dose naltrexone is in 2 microgram dosing. Starts from 2, we can go up to 25. And basically what it does is, imagine a patient on a lot of opiates. This is for patients who are currently on opiates. Mm-hmm. So if you're on opiate and sometimes you need, the dose of the opiate doesn't work anymore. So you have to kind of always increase the dose, and chase the pain. And the reason for that is because opiates work on receptors in your body, or opiate receptors. Mm-hmm. Now, your body is smart. When there's too much opiates, it downregulates the receptors. It's called tachyphylaxis. It's a term, downregulation of the receptors. Hormones do that. Your body's basically kind of protective mechanism. When there's too much floating around, downregulates the receptors so that the opiate response is not that great. Now, for you as a patient in pain, that's not a good thing, because now those opiates are floating around and they have no receptors to attach to. Mm-hmm. Now, naltrexone is an opiate antagonist. It binds to the receptor and blocks it. By doing that, it keeps the receptors around, but it only binds for 2 to 3 hours. So after 2 to 3 hours, it releases the receptor for the opiate to come and bind to and do its thing. So by giving patients very, very, very minute doses of naltrexone, and again, this is 1,000 times less than the 2 milligram naltrexone, it's 2 microgram, mm-hmm. you can actually decrease the opiate dose by 20 to 40% in some studies. Dr. Forrest Tennant is in Fontana here in California. He's done a lot of his research in pain management. Amazing lecturer, amazing physician. He's done some studies on ultra low dose naltrexone, and he showed that you can reduce the opiate dose by about 20 to 40% on average. So we after I read this I believe it was a Townsend letter, in which there's a lot of good information in Townsend letter. I read this, and I started introducing it at our hospice for our hospice patients, and we've noticed for those patients who with escalating pain, we give them ultra low dose naltrexone, and they're able to keep their doses the same. They're able to, if they're on like 200-300 microgram of fentanyl and they keep increasing, they need breakthrough meds, and we put ultra low dose naltrexone there. They're able to keep their doses and have pain relief, which is great, because you don't want to just keep upping and opiates. There's obviously no maximum dose of opiates; it's up to the tolerance. But you don't want to. One is a cost. 2 is just sheer discomfort, the number of pills that the patient has to take. So hospice patients, great response. We had a patient again he was on fentanyl patches. He was taking Dilaudid. He was taking medical marijuana, and we put him on ultra low dose naltrexone. Amazing response. Was able to control decrease the dose of everything. The intervals that he would take his breakthrough meds. The fentanyl patches would last him, they were not lasting him more than 2 days. Now they were lasting him the actual 3 days that they're supposed to. So he wasn't changing them as often. We had a very recent patient, again, escalating dose of oxycodones. Asked for an alternative. We made her a pain cream. She liked the pain cream. She said, I want something stronger. We made her a stronger pain cream. And then she kept asking for something stronger, but there's only so much you can put in a pain cream, because the actives, you can't put more than like 30-35% max. Otherwise, it just becomes a glob of paste. So we said, okay, well, how about we do ketamine, which is another amazing new thing, ketamine in nasal spray. Works really well as an adjunct for pain and works extremely well for treatment-resistant depression almost immediately. So again, for listeners out there that have patients with treatment-resistant depression, ketamine is amazing. You start with a 10 milligram dose in a nasal spray or a capsule. You observe them, make sure they're not hallucinating. Most of them don't. And then you can go up to like 50 milligrams, 100 milligrams twice a day. Put her on ketamine, nasal spray. She loves it. She kept increasing the dose. She said her pain is under control. After a while, again, she felt the need to increase. Again, this is a thing with the receptors. Since her receptors are oversaturating and down-regulating. Doctor asked for a recommendation. We said Ultra Low Dose Naltrexone. That was 2 weeks ago. She called me 3 days ago, and she said it's been 2 days that she hasn't taken her oxycodone, and it hasn't happened. That hadn't happened for like last 5 years. She's gone 2 days without her oxycodone dose. Yeah, pretty amazing.
It is amazing.
Yeah.
Fantastic. So, yeah. Ultra low dose naltrexone has its place, obviously.
Yes.
Oh.
And while we're on the topic, I always like to mention to patients who are taking low dose naltrexone, make sure that your patients are not on long acting opiates, because they will go into withdrawal, and it's not a pretty sight. We had some patients go into withdrawal, long acting opiates. We put them on 2 milligram of low dose naltrexone, and they end up in the emergency room because either the pharmacy or the doctor neglected to see the interaction between the naltrexone and the opiate, and these patients just basically go into withdrawal. So again, just be really careful. Make sure that the patients are not. We're treating inflammatory conditions with chronic pain, fibromyalgia, and a lot of times these patients are already on opiates and they want to try the naltrexone. Well, they can't. We can't just put them on naltrexone, because they will block their opiates, and then they will go into pretty bad pain and withdrawal reaction, actually.
Yes, it's a big consideration, isn't it, when you're on opiates? Yeah. So, your new facility, whereabouts is it?
We're in Glendale, California, which is just kind of north of downtown Los Angeles, about 20 minutes north of downtown Los Angeles. So we serve all of California and all the other states, but in terms of kind of like the same day service, we can do LA, Orange County, Ventura County, San Bernardino. We have drivers because of our work with hospices. We have a fleet of drivers, our own, that we have to keep around for urgent orders. So kind of piggyback on those drivers, and we can service them with pretty much on a same day basis for patients around the area, about 60 mile radius from Los Angeles.
Well, that's really good.
And the rest of the people, we can do overnight.
Mm-hmm. And I was reading on your website, you have Ask Dr. Ike, so people can go there, Enovex.com, and there's a form that you can fill in. And it made me smile, and I was thinking, how amazing is this? It says, results are individualized. However, Dr. Ike is aiming for you to feel at least 50 to 70% better within 2 weeks. So you're obviously the man to speak to if you're not feeling very well. So people will need to get in touch with you.
I mean, sometimes we need to do some functional testing, nutritional, there's all kinds of great testing available nowadays, with maybe Genova Diagnostics and ZRT. And we can do an allergy screen. We can do a stool analysis. We can find out what you're allergic to, what to avoid in terms of foods. A lot of times it's going to come down to an allergen or a bug that's in there that's wreaking havoc on your body. Avoidance, detox, all those things, work really well. So, and the therapies, then a lot of people just qualify for naltrexone. It's just amazing, like the applications of this drug.
Well, it's very interesting, and thank you very much. And you're our gold sponsor at the conference, and I look forward to meeting you there.
Oh, thank you. Just a clarification on the website, Linda. It's enovexrx.com. No, not
I'm
Enovex.
sorry. Okay.
Yeah.
Thank you very much. Enovex Total Wellness Pharmacy is a state-of-the-art, fully compliant, integrated pharmacy specializing in compounding sterile and non-sterile preparations, as well as providing services such as nutrition, IgG and IgE, allergy, stool, hormone, cholesterol screenings, and consultations leading towards a path of optimum health. Contact them at 888-ENOVEX6 or info@enovexrx.com. Any questions or comments you may have, please email me, Linda, Linda, @ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.